The Robert Wood Johnson Foundation is doing a great deal to make sure that these recommendations are implemented. You know, there's been a number of reports on nursing, and we're not at a scarcity in terms of reports and recommendations on what needs to happen with nursing. What's good, or what's a benefit from this initiative, is that the Robert Wood Johnson Foundation is investing millions and millions of dollars to track how the report is being disseminated, to track if these individuals that were identified as being responsible for carrying out some of these recommendations are actually implementing them. And so they had this they've developed regional action coalitions, which are focused as a long-term field strategy to make sure that these recommendations are implemented. And if you would go to that website that's listed at the very end of the slide, you'll find that the Robert Wood Johnson Foundation has put together the recommendations and has also made accessible some of the exemplars or some resources that would facilitate the implementation of these recommendations. is doing a great deal to try to implement some of these recommendations. We just had a strategic planning meeting, and the whole basis for our strategic planning meeting was looking at the recommendations and making sure how we can fulfill some of these and participate in implementing these. The University of Miami Hospital has a nurse residency program which is very attuned with the recommendations we have regarding the nurse residency, and we've also seen tremendous gains and benefits from having this type of residency program. And we're working on trying to develop interdisciplinary education and training and research opportunities. One thing that didn't really come out much in the recommendations, but really is a thread throughout the report, is the idea of interdisciplinary practice and interdisciplinary training. And one of the things that we found is that really in nursing curriculum and curriculum for all healthcare professionals, there's not really enough in terms of providing students with opportunities to interact with individuals from outside or from a different healthcare related discipline. And so that was an area that we saw that was a great need in the future. So all of us have an important role in terms of fulfilling the future of nursing. When we did the press release of the Institute of Medicine report, President Shalala, which again was a chair, she started off by saying, we have entered the golden age of nursing. I really feel that that is a true statement. We're here at these crossroads where we have the Institute of Medicine report. We have a number of other reports that have been recently released regarding nursing and nursing education. And then we have this tremendous need to respond to an additional 32 million individuals that are going to be accessing healthcare. And we have this need to respond to different reforms in healthcare. Regardless of what happens or what the outcome is, there's a general acceptance from everyone that change needs to occur. And change needs to occur in various areas. One of them is that we need to increase access to primary health care. We need to focus more on prevention, etc. And so this provides nurses with unique opportunities to use their unique skill set to respond to these future needs. So we all need to play a role in this to make sure that the future of the nursing profession is fruitful. We need to ensure that nurses are used to the full capacity. So we all have to participate in this and put pressure on state legislators and other decision makers regarding expanded scope of practice, reimbursement issues. We all need to become lifelong learners. If we can, we should get a graduate degree if we have that opportunity. Many of us won't, but if we do have an opportunity that our life and our family affords it, and we're able to do this, then we should advance our education. And we also need to put pressures to facilitate individuals and nurses to continue on and receive higher levels of education. So we need to put pressures for more funding to be available, to have more programs that are conducive for individuals that work and have a family. we need to show leadership in everything we do. In our practice, whether it's at the bedside or in the boardroom, we need to demonstrate leadership in nursing, research, education, administration, and service. And then finally, and very importantly, we need to educate the public in regards to our value. What is it that we do? We need to show the world the value of nursing and be more vocal about it, so that perceptions regarding the role that nurses play in transforming healthcare are changed, and we'd be seen more as powerful agents and act upon that. Thank you so much for your time. I don't know, I think we have 5 minutes for questions, if there's any questions. Thank you. Yes.
Is there a perception among nurses that going back and getting that additional education isn't going to be compensated back when they go back to work?
Yes, absolutely. I think there's the perception and the reality that oftentimes the financial rewards of obtaining a higher level education isn't currently present. I think that's one way, one mechanism, or one influence that we can have in terms of trying to change those, to try to change some of these trends. But absolutely, I think yes. And I think there's also, I think this perception is changing a bit currently, but nursing has traditionally focused, really had a high value on practicing for a very long period of time prior to continuing education. And I think that that has often deterred a lot of individuals when they have the opportunity to continue studying, prior to having, a large family and having to support that, to be, to go back and to achieve higher levels of education. But that culture, I think, is changing. Yes. Yes.
There's currently a very large percentage of experienced RNs preparing to retire and exit stage right. So, was that particular population of wealth of knowledge part of the agenda of how we're going to transfer that as they move away and new folks come in?
Yes, absolutely. One of the things in terms of the workforce is that we have an aging workforce. And so the average age of nurses is a little higher than the general population. And so one thing that will need to happen is that we need to redesign work environments to allow nurses that are older to be able to practice. And we also need to look at ways that we can utilize their expertise to mentor the new generation of nurses coming in. So incorporating them more as educators and in mentorship roles, I think, would be an important aspect of that also.
I don't know if this works, but I have a question on your statistics with respect to the demographics and participation in from Hispanics and other minorities in nursing. Has anyone looked at obviously adjusting some of those demographics, both for education levels of those minorities and also the female participation in the workforce of those minorities, because those might be affecting significantly the statistics that you look at? No,
absolutely. I think those are some of the reasons why we see what you mentioned is some of the reasons why we see underrepresentation from those groups. But we haven't, I don't think that no one has actually adjusted for those differences in the analysis. But I think those are important things to recognize as being responsible for some of the trends that we see. And on top of the education and the gender issue, I think when it comes to, particularly with the Hispanic group that I'm able to speak to a little bit better, there's just a cultural perception of nurses doing or playing a role that is different than what it is in reality. So many Hispanic individuals come from countries where nursing is not a respected profession, and what nurses do in those countries is not the same as what they do here. So I think often parents and families steer their daughters and sons away from the nursing profession because of that.
Okay.
Thank you so much. Thank you so much.
Thank you, Jackie. We have something for you.
Oh, thanks.
But, let me just, on behalf of Cross Country Staffing and all of our corporate nurses here, and of course all of our field nurses who work across the country, we want to thank you for your presentation today on the future of nursing.
Thank you.
It's very
Thank you so much.
enlightening. Thank you very much. And I think
Thank you.
Carol has something to bring up here. She's making it as we speak.
Cookies? I had too many yesterday. Oh, thank you.
Got our hands full.
Oh, wow. Thank you. Thank you so much.
I'm going to let our
Here, I'll take that out
president
of your hand.
present
There
you.
you go.
Oh.
Yes?
This is from Cross Country Staffing, so we thank you for coming here today.
Thank you. That's
And
very sweet.
here is a nice pen.
Oh,
that,
thank you. Beautiful.
So thank you.
Thank you so much. It
And,
really
and she
is
has
an
some
honor
lovely
to be here.
flowers
We
for
do.
you.
We have
Thank
flowers
you.
for as well.
Thank you. When can I come again? Thank you. It really has been an honor
Privilege
to
to have you
be here.
here. Thank you so much.
No,
Well, thank you all for coming.
Thank you.